This conference will now be recorded.
Okay, hello, good morning, everybody. Is my voice audible?
Yes, sir.
Okay, so today we'll see about copper poisoning. So we have seen arsenic poisoning, we have seen lead poisoning, we have seen iron poisoning, we have dealt with mercury poisoning. So and the last one is copper poisoning. So these five metals can be asked in the examination. Almost arsenic poisoning has been asked, copper has been asked, mercury has been asked. So iron has been asked, lead has been asked. So everything is important in metallic poisoning. So all things have been asked, and then we have to remember the silent features of all the things, and then the management, and then the medical legal importance. So today we will see about the copper poisoning. So copper as a metal is not poisonous. It is a normal constituent of human body. You know, if you take a multivitamin tablet, suppose say Ginkgovit tablet is very famous. So most of the time, you might be seen in the prescriptions given by the doctors to your parents or to your elders, where Ginkgovit is used for a multivitamin, for supplementation, for strength. And in that you can see so many metals are there. If you can read on the back side of this Ginkgovit strip tablets, you can see on the back side along with the vitamins A, D, vitamin B, vitamin K, and then you can see the metals like copper, you can see selenium, you can see zinc. So all these metals can also be seen in the vitamin tablets. So this copper, it is a normal constituent of human body. We have some of the poisonous compounds of this copper metal. One is copper sulfate, which is known as blue vitriol because of the blue crystals. Copper sulfate, which is called blue vitriol, and it looks like crystals, blue crystals. And then we have copper subacetate. We call other name is verdigris. Copper subacetate, otherwise called as verdigris. It is bluish green powder. And then we have third one, acetoarsenite, copper acetoarsenite. So we have sulfate, subacetate, and acetoarsenite. Copper sulfate is blue vitriol due to blue crystals. Copper subacetate, which is verdigris, which is bluish green powder, and then we have copper acetoarsenite. What are the uses of this copper? So copper is used in insecticides, it is used in fungicides, it is used in algicides, and then it is also used in making alloys. So insecticides, fungicides, algicide. Algicide is one is which destroys algae in swimming pools. So swimming pools are disinfected by these copper containing products. And also you can see these copper containing products are also used in infertility cases in human. You know, suppose if a married couple are there and then they want to space the birth, then we have a IUD called intrauterine device, IUD, in order to space the birth. And one such IUD is T copper. T copper, where the IUD will be in a T-shaped manner, and then you have the copper wire wounding around that thing, and then we have to insert this T copper device inside the uterus, so that this copper containing products has an anti spermatic action. So that's why even though the married couple willing to space their birth for 2 to 3 years can use this copper containing IUDs. So that is also one more use of copper in medical fraternity. What are the toxicokinetics? What are the safe dietary intake is around 900 micrograms a day, which is required for functioning of enzymes like catalases and peroxidases. So normal daily dietary intake is about 900 micrograms. 900 micrograms of copper necessary for catalases and peroxidases. In serum, it exists in two forms. One is albumin-bound form and then ceruloplasmin form. In albumin-bound form, it is about 7%, and then ceruloplasmin, it is about 93%, which is nothing. Ceruloplasmin is a copper enzyme. So in blood, it exists in two forms: albumin-bound and then ceruloplasmin. So more of percentage is there in ceruloplasmin form in blood. So poisonous compounds are readily absorbed from the mucosa of the mouth and then lungs and any raw surface in the skin. So it can be absorbed through any surface from the skin, absorbed from the mucosa, absorbed from the lungs, and then it is excreted in stools, urine, saliva, bile, and milk. What are the signs and symptoms of copper poisoning? The fatal dose of copper sulfate is 30 grams. Copper subacetate is 15 grams. And fatal period is about 1 to 3 days. Fatal period is 1 to 3 days. Fatal dose is about 30 grams for copper sulfate compound and then 15 grams for copper subacetate. Symptoms appear within 15 to 30 minutes. And the symptoms are: the patient will have a metallic taste, there is increased salivation, increased thirst, burning and colicky pain in abdomen associated with nausea and vomiting, vomited material can be about blue or greenish in color based on the compound he has consumed. In severe cases, there can be hemolysis and then hemoglobinuria, jaundice, pancreatitis, cramps or spasms of the legs can be seen, and then convulsions can be there in severe cases. And then in some cases, there is paralysis of both limbs followed by the CNS symptoms, the drowsiness, insensibility, and then coma. And death is mostly due to organ failure, hepatic and renal failure, or both. So these are some of the brief symptomatology of copper poisoning. The patient will have metallic taste, increased salivation, thirst. There is colicky abdominal pain. Colicky abdominal pain, we can see it is also present in lead poisoning. Colicky abdominal pain is also one of the feature of lead poisoning. And then we have the vomited matter is bluish or greenish in color. In severe cases, there can be lysis of the blood, hemolysis, and then hemoglobinuria, jaundice, pancreatitis, convulsions, and there can be in some cases paralysis of both limbs with drowsiness, insensibility, and coma. And death is due to hepatic and renal failure. What are the signs and symptoms based on the mode of inhalation or mode of poisoning? If it is by inhalation, there can be respiratory irritation with sore throat. There can be cough. Nasal mucosa may show atrophy with perforation. So nasal mucosa perforations can be seen in copper poisoning. So on inhalation, there can be respiratory irritation with sore throat and cough, and then nasal mucosa can show atrophy with perforation. On contact on the skin or on the eyes, there can be conjunctivitis or palpebral edema. There can be contact dermatitis, greenish or blue discoloration of skin in severe cases. On the diagnosis, we can make by measuring ceruloplasmin. We know that about 93% it is there in the plasma, and then about 7% as protein bound. So we can measure the more widely available. So by measuring serum ceruloplasmin levels, if it is less than 35 micrograms in 24 hours, then it is said that it is of serious toxicity. Normal ceruloplasmin levels are greater than 20 micrograms per dl, greater than 20 micrograms per dl, and if it is greater than 20 micrograms per dl, if it is ceruloplasmins are more, means beyond, it is not less than, it is beyond. It is beyond 35 mg per percentage. If copper containing products are there, then the patient we can diagnose as copper poisoning. So we have to correct it. So it is about 35 milligrams percentage greater than, not less than. So please correct it. And then blood copper levels of greater than 1.5 micrograms per 100 ml is suggestive of poisoning. So we can measure the bound copper called ceruloplasmin, or we can also measure the copper metal or element itself in the blood. Suppose, and then if the metal is greater than 1.5 micrograms per 100 ml, it suggests the patient is suffering from poisoning. If the ceruloplasmin levels are greater than 35 micrograms percentage in 24 hours, then also it suggests that poisoning is present. So what is the treatment? Treatment is gastric lavage, where we will inject the water and then we will take it out, the remaining contents of unabsorbed copper content products in the stomach with 1% potassium ferrocyanide. So gastric lavage with 1% potassium ferrocyanide, it forms an insoluble cupric ferrocyanide, which it can be taken back by the gastric lavage. Here emesis is contraindicated because there is a chance for aspiration, and then demulsions are useful. Castor oil to remove poison from the intestine can be used, and then chelation therapy is with penicillinamide or BAL or EDTA. So copper, we use penicillinamide as an antidote primarily, and other things are BAL and EDTA. So gastric lavage with 1% potassium ferrocyanide, leading to formation of insoluble cupric ferrocyanide, and then we will remove this cupric ferrocyanide by gastric lavage. Emesis is contraindicated. Demulsions and castor oil can be used, and chelation therapy is with penicillinamide or BAL or EDTA. What are the autopsy features? Because the copper containing products are either bluish or greenish, we can see these bluish or greenish prothernose, and even the stomach contents can also be having the color of the bluish or greenish nature of the stomach contents. The gastric mucosa can look greenish or blue, inflamed, and sometimes eroded. And then liver is soft and fatty. Liver is soft and fatty. So these are some of the products we see. So greenish or bluish prothernose. Then we have greenish mucosa, gastric mucosa, which is inflamed. Sometimes it can be eroded. And then we have soft organs. One example is liver. This is one more entity can be seen called Fischer ring, KF ring. So KF ring is seen in copper poisoning. KF ring stands for Kesher Fleischer ring, which is the name of the scientist. Kaiser Fleischer ring, which is nothing but a bluish line at the edges of the cornea. At the edges of cornea, there is copper depositions can be seen at the edges of cornea, and it is known as Kaiser Fleischer ring, otherwise sometimes called KF ring, present in copper poisoning. You can see this is the autopsy pictures of copper poisoning. You can see the greenish staining of the intestines. So greenish bluish staining of the intestines can be seen in copper poisoning. So what is chronic copper poisoning? So all these things which we have seen up to now are the features of acute poisoning, and now the features of chronic poisoning. So spraying copper sulfate as an insecticide in vineyards can cause a disease called as vineyard sprayer's lung disease, characterized by histolytic granulomatous lung. Characterized by histolytic granulomatous lung. So vineyard sprayer's lung disease. Vineyard sprayer's lung disease is seen in chronic copper poisoning. Vineyard sprayer's lung disease is seen in chronic copper poisoning due to spraying of copper sulfate as an insecticide in vineyards. Vineyards sprayer's lung disease is seen in chronic copper poisoning. And what is the characteristic feature of this vineyard sprayer's lung disease is the patient will have histolytic granulomatous lung. Histolytic granulomatous lung. And then chronic contact with swimming pool water containing algicide can cause green hair discoloration. Green hair discoloration of the persons can be seen in persons who are in continuous contact with swimming pools which are alginated with copper containing compounds. And then one more feature seen in chronic copper poisoning is chalcosis, which is the presence of copper deposits in tissues known as chalcosis. So vineyard sprayer's lung disease is present in chronic copper poisoning. Green color hair discoloration can be seen in a person who is exposed to chronic copper poisoning in swimming pools. And then chalcosis, where copper deposits are present in the tissues. So some of the other symptoms of chronic copper poisoning are anemia, green line on gums, colicky pain, diarrhea, malaise, atrophy of muscles, and then peripheral neuritis. Anemia, green line on gums, colicky pain, diarrhea, malaise, atrophy of muscles, and then peripheral neuritis. What is the medical legal importance? So copper poisoning, copper containing compounds can be used as an abortifacients. We have known that abortifacients, if it is more, we have known that there is a entity called abortion stick. Abortion stick is where the calotropy stem can be used as an abortion stick along with other poisonous plants, and then this stem can be inserted inside the vagina into the uterus in order to expel the contents, the fetal contents, because of the milk secreted from these stems. So the calotropis plants, you can see there is a white color milk secreted, white color milk-like compound, a milk-like liquid which is secreted, and then it will cause irritation of the uterus, and then it will cause expulsion of the fetus. So these compounds, whenever this abortion stick can also be mixed in resins containing this copper arsenic lead compounds. Resin is there, one liquid resin can be there, and then this abortion stick at the end is tied with a cloth, and then this cloth is soaked in the resin containing these copper containing products, and then this soaked cloth is inserted into the uterus so that it will cause irritation of the uterus and then expulsion of the fetus. So it is used as an abortifacient, and then it is also used as a cattle poison. Cattle poison, it can be mixed, the compounds of copper can be mixed with the food material of the cattle, and then they can be fed, and the cattle can die. So mostly the enemy cattle, the persons, it is not an accidental poisoning. Mostly it is a homicidal cattle poison will be there, where a person who doesn't like the other person and who wants to harm, then he can mix the copper sulfate products or any other compounds of copper into the eatables of animals. And then in humans, copper poisoning is mostly accidental and seen in children, and sometimes it is industrial. Occupational therapy poisoning is more. You can see in children, it is often put the crystals in their mouth and attracted by their shining green color. So accidental poisoning can occur in children because of the shining nature of the copper, blue color nature and green color nature. The children can easily put the crystals in their mouth. And then coin ingestion. We have in India copper coins. Indian rupees like 2 rupees and 5 rupees coins are made with the cupronickel substance, and then children will accidentally can ingest these coins and then can lead to accidental chronic copper poisoning. And then third one is cookware. We have copper utensils and copper cookware. Yeah, so continuous or repeated cooking in copper containing vessels can be a source of copper toxicity over a period of time. And then vegetables. So sometimes vegetables are, in order to enhance the green color of the vegetables, you might be seeing in YouTube videos where some people illegally, they will, in order to make the vegetables, green color vegetables to look more green, to more shining, they will mix these copper containing products with the vegetables, and then they will sell it. So if you are not properly washing the green vegetables, then it can be easily poison the person over a period of time. So copper salts are used to enhance the green color of the vegetables. If vegetables are not washed properly before eating, can cause poisoning. So these are the 4 methods by which copper poisoning can occur by accidental method. One is by children taking up the crystals into the mouth, and then coin ingestion of 2 rupees and 5 rupees, which are made up of cupronickel, and then repeated cooking in copper containing vessels, and then eating unwashed vegetables which are washed with copper containing water. Medicine. Copper is also used in medicine. Copper has been used for a variety of diseases. One is, it is used in treatment of burns and other wounds, mostly diabetic wounds. So if there is a chronic diabetic wound, and if the wound is growing beyond the tissues, then we can rub the tissue with this copper crystal so that it will cause the leveling of tissues along with the surrounding skin. And then we have contraceptive pills. As I told you, it increases copper levels in the body because of close association between estrogen and copper levels. It is used in copper contraceptive pills, and also copper is used in dental casting, gold alloys, dental amalgams, and then IUDs, intrauterine devices. So it corrodes, releases copper ions into the surrounding tissue, and then it causes toxicity in these cases. So we have IUDs as a contraceptive method, and then dental casting, and dental amalgams. It is used, and then hemodialysis is also copper is used in the dialysis. Heating coils can be released, especially if acidic water is used in hemodialysis. So these are some of the examples where copper is used in medicine. It is used in the treatment of burns, wounds, contraceptive pills, IUDs, dental amalgams, dental castings, gold alloys, and then hemodialysis. So last one is metal fume disease or brass disease or foundry fever or Monday fever or smelter shacks. So this is one fever that occurs in workers working in welding, smelting industries, metal refineries, and electroplating and alloy making. It is caused due to inhalation of fumes produced when metals are heated above their melting point of metals like zinc, copper, magnesium, iron, chromium, cadmium, nickel, mercury, cobalt, lead. So in that, copper is also one entity. So metal fumes disease, where the inhalation of fumes when metals are heated beyond their melting point. Symptoms will start about 6 to 8 hours after exposure, and the symptoms are mostly flu-like symptoms. The patient will have fever, chills, cough. There can be breathlessness, cyanosis, myalgia, tachycardia, and symptoms are improved after removal from the exposure in 36 hours. And then treatment to this is symptomatic. And then nickel, one of the nickel fumes, if they inhale, it can cause lung cancer. And if cadmium is there in metal fumes disease, it can cause a painful bone lesions known as ouch disease. So cadmium will cause painful bone lesions known as ouch disease, and then nickel can cause lung cancer. So why it is called a Monday fever means these workers, they are fine till Saturday and Sunday. Whenever they come on a Monday to work, they get exposed to these metal fumes, and then on Monday they will, at the evening, they will get the fever, chills, cough, and flu-like symptoms. That's why it is called Monday fever. So metal fumes disease or brass thing or foundry fever or metal fever or smelter smacks is all the same. Metal fumes disease has been asked as an examination question, as 2 marks question. So I can go through this. So what is forensic significance? Last slide. So it is rarely suicidal or homicidal. Only it is used in homicidal purpose as in cattle. It is most of the time it is accidental. Verdigris is formed when vegetable acids come in contact with cooking vessels, thereby making the food poisons. Sometimes copper is added to maintain the green color of the vegetables. We know that. And copper salts are sometimes used for abortion. So these are some of the forensic significance, mostly used in accidental purpose. It is the vegetable can be a vegetable poisoning, can be used as an abortifacient, and then it can come as a cooking, prolonged cooking in copper containing vessels. So that's all for copper poisoning. Thank you very much. Thanks for joining. So from next class, we will start another new chapter. If you have any queries, you can ask me. You can mail me, or you can even write in chat box. Hope you are doing fine. Keep reading, keep studying, and then we will meet some other day, some other time, face to face, so that I can see you and you can see me. So thank you very much. Thanks for joining. You can leave now.